Hello, I'm Dr. James Bogash, expert in health and longevity and creator of Bogash Life and Balance. And today we're going to talk about the Israeli prior immunity vaccination study, which by now you've probably heard of. And we're going to talk a little bit about some of the nuances with it and what's really important with this. And anybody who's been following me has known that my frustration has been that we are completely ignoring the concept of prior immunity, people who had COVID, as if they don't matter. And regardless of anything, we need to hammer that everybody, regardless of anything, needs 2 vaccinations. And if you happen to be in that particular scenario where your work or travel or anything, like this push is becoming completely unscientific without any thought to what's going on with the individual. And I'll talk to in a minute about why that's the case and why it's a problem and why when people find out that, because the reality is we can't hide anything anymore. We know, as long as you know how to interpret it, the data is at our fingertips. Things like the Israeli study that I will post in the description section is readily available and people can look at the data themselves. I've always said, stop looking at the damn headlines. They will do nothing but confuse you, and they are designed to be clickbait. I heard a conversation today just talking about how it's like the equivalent of watching a horror movie, and the next villain or death or whatever will be completely dependent upon what people clicked for the preceding scene. So in other words, the media is driving what people are clicking on or even just sharing, not even reading the articles. So there are some people that actually think out there that natural immunity is not better than vaccine-induced immunity, and I've heard people go as far as to say, well, it's a brand new virus, we can't fight it off. And somehow, like, I don't know how the messages got so darn mixed, but they did, to the point where people actually believe that the human immune system can't fight off a virus it's never seen before. The obvious answer would be every toddler would never make it past 4 if that was the case. They'd die when they saw any number of first viruses that they came across. But again, this media message has been hammered so hard that people don't believe it. Even now, there will be people out there who will comment on this video or have some type of comment, well, this isn't true, without actually looking at the data. And this is just yet another one that confirms that natural immunity is as strong or better than vaccine-induced immunity. The only study that's been different has been the CDC study out of Kentucky on not even just cases, just positive PCR tests. Lots of questions about that study. And wow, but a whole other conversation about why the CDC, how they managed to come up with different numbers than pretty much every other study from around the world. This one has to do with, this particular study came out of Israel, and I've said before that I'm beginning to trust less and less the data coming out of the United States and more out of like UK and Ireland, or I'm sorry, UK, Ireland, and Israel. So it was an interesting way they set this up. Very large study. And as I said, Israel has most of their people under a single health plan. I think like 70% of the population. So they have their data at the fingertips. They can get it and tease it apart anytime or in any way that they need at that time. I do have to say that this is a preprint, which doesn't necessarily matter to me. It matters to people that don't believe that natural immunity is stronger, but they'll use preprint for other things. That's like, you can't have it one way or the other. I find that most people who would say that, well, this is preprint, would then use examples or ideas or concepts from other preprint articles, and that's okay. So, again, it's data out of Israel. They have it, they've been consistently publishing on this, and their stuff has been solid. So no reason to think that it's going to be different when it's under peer review. So first of all, we do have to say that vaccination has clearly helped with people, both cases or hospitalization and death. It's pretty clear that it lowers the incidence. That has nothing to do with, I'm not saying people should go out and get infected with COVID and have COVID parties versus vaccination. It's all an individual decision based on your risk. I had COVID back in January. It wasn't a big deal. I'm confident that my immunity is as good or better than it would be if vaccinated. So the study looked at it. The other thing that's interesting is that we are clearly seeing a waning of immunity over time, and that was and not with natural immunity, but with vaccine-induced immunity. And so the United States, like the data come out and on pre-approval for full approval, we now have 6 months of solid data that started 3 months. It's just ridiculous to say that it wasn't a good picture on how immunity might be waning. It had nothing to do with the Delta variant or Mu variant or any other variants that are coming through. But they looked at large study, almost 50,000 people, and they looked at people that were vaccinated, fully vaccinated, or previously infected around the same time, basically early in the year 2021. And they also looked at people who were infected and also had one vaccine out of the Pfizer dosage. So we'll talk about that as well. But they found that there's an very important part about that that we're not doing here in the United States that I'll bring up when they're. So over all of these people, they found that of the people that the breakthrough infections, if you will, overall there were 257 cases. Cases again, not symptomatic. 238 of those were in the vaccine group, and 19 in the previously infected group. So like out of, I want to say there were 16,000 people in the pre-existing, like the breakthrough cases in people who had it were very low. They were also in the vaccination group, but definitely a big difference. So it's not that vaccine wasn't effective, it's just that natural immunity was more effective. And so again, somebody who says that natural immunity isn't good enough is missing all of the research that's coming out. So that was about 13 times higher risk of breakthrough infection in vaccination versus prior infected. When it comes to symptomatic infection, those numbers were a little bit lower, about 199 cases. Only 8 occurred in the COVID positive. The rest were in the vaccinated group. So huge difference. Again, I want to say 27 times better protected against symptomatic infection. What I thought was interesting, in hospitalizations, there were 8 in the vaccinated group and only 1 in the prior infected group. So again, across the board, looking at anything, there was a protection and better protection. So why do we still have this blind dedication in the United States that it doesn't matter what's happened to you, you need to get 2 shots? And I will tell you, it comes down to logistics. That means, how do we prove that somebody's been infected and now has, we could certainly do antibodies. That's not reasonable for everybody to have antibodies done. But just saying that somebody's been infected is not enough to prove that they were infected. And so the public health officials are like, well, we can't figure it out, so screw that. Everybody needs to get vaccinated, despite the fact that it flies in the face of the research and what we know of human physiology. Damn the billions of doses that have gone bad or have been used without effectiveness. This is certainly highlighting the United States, UK, Israel, and how much we don't care about the rest of the globe as much as we talk about it. Otherwise, these doses would have gone somewhere else instead of here. What was interesting with the people, they compared the unvaccinated infected to the vaccinated with one infection, or with the the people who had COVID who got one vaccination. So forget the two vaccination. Two important things with this is, first of all, they didn't feel the need to give that second vaccination. So again, this logic thing playing out. The other thing was that they waited 3 months before they could get the first vaccination. Again, here in the United States, that doesn't matter. You need to get that second. You need to be under 4 weeks, despite the fact that they may blow up in our face in the near future when we finally decide to look at that question. But they waited 3 months, and they found that there was slightly better protection in the people who had COVID and had a single vaccination from people who just got ill. So what does this mean? It means that natural infection is as strong as we believe it to be. There's every indication that it will probably last for as long as you need it to last. We have no idea how much longer the vaccination is going to help. It's already starting to show signs of waning. I don't see that changing. I just see that progressing, hence the discussion of a booster dose, which isn't really a booster dose. It's just the second dose, but we gave the first two too close together. If you're really nervous and you'd like some additional modicum of protection, considering the first vaccination might make a lot more sense than wasting that second one when it could go some other place that needs that vaccination more. As always, I'll post a link to this particular study in the description. Make sure you like this video, share it with somebody who you think needs the information, and subscribe to the channel.